Okay, I think that's. I think everyone's here. Thank you. Thanks everyone for joining. Uh, Particularly because I think I in particular was not didn't do as great a job as promoting this as I should have. So thanks everyone for joining. The topic of this panel. This is an economics for inclusive prosperity event. And what we decided to do was have a couple of panels today. So this is the first panel. The second one will be moderated by Danny in the afternoon at 4 p.m. Eastern on more medium and long run priorities for the administration. Today, we're going to talk about in this session, we're going to talk about the short run policy priorities. And the rough order and topics go Amy Kapuscinski from Yale Law School talking about vaccines and their distribution. Atif Mian from Princeton, who's going to talk to us about macro policy. Hilary Hoynes from Berkeley, who's going to talk to us about relief and the social safety net. And then I think pulling it all together and also making us sort of keep the eye on the prize of what is also short run policy is Trevon, who's going to be talking about race and reparations. So with that, I'll turn it over to Amy to talk about vaccines. Go for it.
Great. Thanks, everybody. Nice to be here with you all and to have something on the relatively optimistic side to be talking about. So I'm going to talk a little bit about vaccines and both sort of the state of play where we are now and then what the key challenges are as I see them kind of going forward. So you've probably all seen the headlines about vaccines that are now, actually we have 2 of them that are under review at the FDA in the United States. So they are going to go through a process that is not the full approval process, but the emergency authorization process. So those 2, we already have data in hand at the FDA. There are actually many more vaccines that are still being studied and that are in other stages of the clinical trial sort of study process. Some of those vaccines, in fact, have operational advantages over the 2 that we have the best data for so far, the Moderna and the Pfizer vaccine, particularly. One is a 1-dose vaccine, for example. Others are easier to store and distribute for various reasons. So there's quite a lot more in the pipeline. And so there's actually a lot we still don't know about what vaccines we'll have to hand. It's also just important to note that, as I'm sure this audience will appreciate, most of what we have so far about the vaccines is really press releases and, very top line levels, summaries of the data. So for all of them, we need, more information about the data that we have to really understand the scenario. And of course, there's lots of vaccines that we still don't have any data for at all. But for the 2 vaccines that the data has been submitted for to the FDA, the top line kind of press release results are really remarkably good. Moderna's vaccine, it's around 95% effective at reducing symptomatic cases. And there were no serious cases in the vaccinated arm. The Pfizer results are very similar with 1 serious case in the vaccinated arm. Of course, these trials, which were around tens of thousands of people, there's still things we don't know. There may be, very rare adverse events, for example, that we won't see until they get to a broader population. Probably the most important things we don't know beyond rare adverse events are how long protection is going to last for these vaccines and whether you can still transmit the virus, even though you're not getting serious cases of illness. Those are huge, outstanding questions. It may well be many, many more months until we know the answers to those questions. So where are we and what's next? So we could have vaccines authorized by mid-December, January. But there are many, many problems that lie ahead in the logistics of getting enough vaccines made and distributed. So Suresh asked me to talk for not more than 10 minutes, so I'm just going to stress a couple of things. One, assuming that the evidence holds up, this should be understood as an enormous success, in fact, of public science, although a lot of the credit is going to be taken by the private companies that are at the end of the line. So I'll say a little bit about that. Two, there's major challenges in rolling these vaccines out. That's because in part in the United States, we don't really have a healthcare system. We've never done anything like this. And as the debacle with unemployment benefits showed, we have major weaknesses in government capacity created by years of austerity, budgeting, and other kinds of problems in our kind of basic commitment to social infrastructure and governmental capacity. There's vast equity issues that are likely to, if they are not taken very seriously, make this vaccine a part of the problem of health equity as opposed to one means to address it. So I'll talk about that. And then globally, there's not a lot of attention in the US to the global picture, but of course, without any ability to control the virus globally, our ability to return to normal forms of, trade, travel, life remain very limited. So existing approaches don't even imagine meeting global supply needs for the vaccine until 2023 or 2024. So I'll talk a little bit about what I think should be done on that score. Okay, so first, the sort of massive success of public science. So the US government alone put $10 billion into Operation Warp Speed, and every single vaccine that is one of the leading candidates has in fact received major public funding. Operation Warp Speed, in fact, gave Pfizer a $2 billion advance purchase agreement. So Pfizer has been very high profile with its CEO coming out saying we didn't receive any public support. Actually, the Pfizer vaccine comes from the tie-up with a German company, which received hundreds of millions of euros from the German government. And also this $2 billion advance purchase agreement surely de-risked the investment for Pfizer in an important way, particularly given that, as I'll say a little bit more about, Pfizer's vaccine is one of the most difficult to administer given the cold storage issues. For the Moderna vaccine, shockingly, the company itself has said that it was 100% funded by the federal government. And that's pretty unusual. The NIH may, in fact, even have some key intellectual property in the foundational technology through which these mRNA vaccines, actually both the Pfizer and the Moderna ones, operate. They use mRNA to code for a spike protein, and the manufacture and bioengineering of those spike proteins was importantly is based on work done by the NIH. And more broadly, I've been working on global vaccines issues for many years, and there's been a huge sort of public investment in vaccine infrastructure, particularly after the avian influenza scare, which you all probably heard about in 2005, and then SARS and MERS. And so the sort of, it's really a long background of actually very substantial investment in new vaccine platforms, as well as in coronavirus vaccines, given that SARS and MERS were both coronaviruses. That has kind of put us in this really amazing place where 9 months really has put us, within 9 months, we've got vaccines that could really be operationally out and available. Okay, so now the bad news, which is about the challenges actually getting vaccine widely available. So let me start with the United States. So the entire infrastructure for delivering the vaccines is basically it's like building the train tracks while the train is running down the tracks. Nobody is ready. It's really relying very heavily on the state, on the states. So the states are responsible for the rollout plans. Many of them are just getting going. The feds are going to give guidance about key issues like prioritization, but the fundamental decisions will be made at the state level. So what are the challenges? We have limited supply. So, right now we know that we have, tens of millions of doses of these vaccines. The most optimistic projections that I've seen have said that we could have 45 million Americans vaccinated by the end of January. That is assuming, I think, everything goes right. And so that's obviously far less than what we would need. And the projections are also that it'll take at least a year to really start to reach full population sort of herd immunity levels. Of course, we don't even really know what those are yet, much less the issues around getting vaccines to people and getting people willing to take them. So on the limited supply issue, my field is intellectual property, and there are some really interesting questions about whether monopoly supply is a good idea in a moment like this. We are in a situation where we have monopoly supply, despite the vast government investment. And one of the questions that will be asked, particularly after the first wave, and particularly because we may need to re-administer these vaccines, will be, is monopoly supply a good plan for such a massive infrastructural challenge? And I'm happy to talk if people want to hear about the options around the intellectual property issues. One of the difficulties, and this is a classic problem of intellectual properties, we don't even know who holds it yet. Patents are not published typically until 18 months after application. So we don't even know what the patent landscapes look like, although according to the companies, they hold many patents that will be relevant to the production. All right, so that's on the supply side. So we have real challenges scaling up supply. And that's for the US, which is best off probably of anywhere in the world. Now on the delivery side. So as we've all read, Pfizer's vaccine requires really deep cold chain of a kind that's we don't have any experience with really. And Moderna's vaccine is easier. It's sort of a more normal freezer situation, can even be kept in a fridge for a month after you transport it. So these vaccines require 2 doses. That's a huge operational challenge. It means you have to get people back, including people who had a sore arm and felt like they had the flu for a bit after getting the vaccine. So you've got real issues. You've got to also track people because we don't know the long-term effects of these, and we've got to build, and build out a data infrastructure to track people. There's a huge amount that has to be done to inform people about the virus, about the vaccine, and to build people's trust. And then what's the infrastructure going to be for actually delivering the vaccines? In the very first tranche is likely to focus on healthcare workers and people in the elderly in long-term care facilities. Sort of easier to see how that's going to happen. Then after that, the plan is largely for the private infrastructure to be the basic apparatus that we will use. So things like CVS and the pharmacies that exist. And otherwise places like primary care physicians where people will get their vaccines normally. But there's really substantial gaps in, I think, even what's being planned at that level, right? So how are we going to handle pharmacy deserts, which do exist all over the United States? Rural areas may be particularly hard to serve, particularly if you need a serious cold chain. What are we going to do about prisons? What are we going to do about the undocumented, right? What do you do about the uninsured? So there have been, really, because this is such an exceptional emergency, Congress has acted to make sure that there's a lot of things in place to make the vaccine free at the point of care to individuals. But there are some gaps in that system. And the one that I think is the most obvious is actually around the uninsured, because there's a limited pot of money to deal with to give vaccine to people who are uninsured. We're also bad at giving vaccine. First of all, we don't do a lot of adult vaccinations. Second of all, we're bad at reaching populations like the uninsured with vaccinations. They don't have a GP, right? So how are you going to reach all of those populations? We know from things like the flu vaccine and the swine flu experience that we're not good at reaching those populations, and we're not good generally at reaching vulnerable populations. One thing that's important to sort of flag from the broader health equity literature is that, and this is sort of surprising, when you get a new intervention, you'd think that improves health equity, right? You got a new intervention, like a 95% effective vaccine. Actually, they often do the opposite. Health equity often takes a hit when you get a new intervention like this. Why is that? Well, it's exactly what I'm worried about with respect to this vaccine rollout, which is that where we have good infrastructure already, people will be quick to get vaccinated, but where you need really much deeper work to get to communities and to get the follow-up that people need and to fund the systems that need to be funded, we won't bother and it won't happen. And so we'll get inequity around the delivery of vaccines. I think that's a very likely problem. And right now, the other part of the scenario that's really worrisome is that there's no money for any of this. There've been a couple $100 million compared to $10 million getting the vaccines into production, $10 billion, a couple $100 million to try to work on these delivery issues. We probably need, billions, certainly billions. Schumer came out yesterday saying 30 billion. It's not clear exactly what's involved in that estimate, but we need lots of money to go to the states to manage this process. I think we also need a kind of personnel surge to be able to address, in particular, the health equity issues that we're going to see. Think about how we're going to handle it. No one's really, I spent some time talking to people who are working on this in Connecticut and other places. People haven't deeply thought through this question. What are you going to do about undocumented folks who are many of them essential workers who are supposed to be among the earliest priority? So what are you going to do when they come in and where are they going to get it? How are they actually going to have follow-up? How are you going to assure them that the follow-up, which is going to require they give their name and their address so that they get that second vaccine? How are they going to trust? this situation enough to actually be able to be reached by the vaccine. So for things like that, we need lots of, I think, community engagement and trust building that can only be done with the kind of people power that we yet don't have. I can say more about pricing if people are interested. Right now, nobody's talking much about the pricing issues, in part because the price per dose is somewhere between $25 and $35, and that seems small compared to the price of the virus and its impact on our society and economy. But over time, particularly if we have to do it again and again, that will become an issue. And of course, in the US, we have no system to address drug pricing in any coherent way. I know I've already gone on, but maybe I'll say a few words about the global situation and then stop. So globally, we really have vast supply concerns. So around the world, there's been lots of advanced purchase agreements. There's no real transparency about those agreements, but this is exactly what we've seen with other issues like the avian flu scare and swine flu. Rich countries buy up all of the available supply in advanced purchase agreements. For example, there was some reporting that suggested the Pfizer vaccine, 80% of its already production capacity has already been purchased by rich countries. And that's probably what I would expect, given what we've seen in the past. There is something called the COVAX Facility Project, led by the WHO, Gavi, the Vaccine Alliance. They are hoping to get enough doses to meet 20% of the need of populations that are kind of contributing to buying into cooperating with this alliance, which is not even every country. The vaccine that at the moment would work best, the Oxford one, the AstraZeneca one that would work best for delivery in resource-poor settings, the results are kind of puzzling, and it's not clear when we're going to really get clarity about how well it works. So the last thing I'll say there, and this comes again from me being somebody who's worked on IP issues and access to medicines for a long time, which is that one real question will be, will we support, as the United States, which we historically have not done, will we support kind of open IP in order to address some of these manufacturing challenges, to allow people, countries around the world to freely make vaccine or purchase vaccine outside of the monopoly supply chains if they can. It's particularly important given the lack of supply that is going to be available in resource-poor settings. And there are ways to do it under existing international law. Happy to talk about those. They're a little bit complicated, and so there's also been a push to waive the requirements under the TRIPS agreement, under the WTO's agreement, that you have to get through all the hoops you have to jump through to be able to make generics. The US has been opposed to that. And one real question is whether or not we're going to continue that going forward, or whether or not the Biden administration is going to see the virtues of taking a sort of longer term, more public health approach to vaccine supply around the world, particularly in a context where we've got such major challenges getting production up to scale.
Great, thanks. That was a lot of information, Amy. That was great. Thanks a lot. I'll now ask Atif to chime in on the macro issues.
Thanks, Suresh, for having me. I'm going to talk about sort of the macro situation in the short run. Let me take a step back and just talk a little bit perhaps about the intellectual history of how we think about short-term macro effects and why that may not be that useful anymore. So traditionally, we think we have the luxury of kind of separating the short run from the long run, and that's very much embedded in the intellectual framework that we use for evaluating short run policy. So the most famous one is sort of the so-called sort of Keynesian hypothesis, which essentially says that in the short run, the stuff that matters is like nominal rigidity, prices and wages find it hard to adjust in the short run. And because of those frictions, we need the government or the central bank and monetary policy to step in so we don't suffer from those frictions. And while those frictions get resolved in the long run in the background, fiscal and monetary policy should come and stabilize the economy. So that's very much kind of the traditional view of how to think of short-run macro policy, both on the fiscal as well as on the monetary policy side. So the first point that I would like to kind of highlight is that while that sort of framework has been quite useful in the past, it may not be as useful or relevant anymore. And so that separation between the short run is becoming, I think, harder and harder to justify in my view. And let me just illustrate why I'm saying that with just now coming to the most recent recession, which is the COVID-driven recession, and talk about some of the deeper structural issues that it again highlights in front of us. And I think even the short-term immediate policy needs to keep those structural long-term problems in mind. That's the point I want to come back to. So let's go back to the most recent recession. And while we all know that unemployment rose and sort of people suffered because of the virus, what is really stark about this particular recession is the unequal nature of it. Again, we know all recessions are in a sense unequal in their impact. Some people are naturally much better protected, especially those with assets and buffers of various sorts. So that's always the case. But even relative to the previous recessions, it's really incredible. And I think this continues to be underappreciated, just how unequal the impact of this particular recession has been. And the other thing is that dimension is global in nature. This unequal nature of this recession is not only true for the US, but it's actually true across the world. You know, the so-called Zoom world is protected and everyone else is suffering much more. But there's something else that results from that unequal impact. And that's the deeper thing I want to come back to. So let me sort of focus on that for a bit. So one way to summarize the unequal nature of the COVID recession is to look at the impact on both the income versus the expenditure side. And again, that's where the impact is very asymmetric. So if you think of the income side or the employment side, if you like, people who are for various reasons who are on the lower income spectrum, so they are not earning as much as the top half or the top quarter, for example, they have been much more impacted. So they are much more likely to get laid off, essentially. And as a result, they have a much bigger hit on their income. That's number one. So obviously, when they have less income, they'll cut back on spending. That's sort of the natural response. But typically, you would expect or at least hope that people who are getting less impacted on the income side, they don't cut back as much on the spending side. But this is the second kind of big sort of fact of this particular recession. And again, it's global in nature, which is that unfortunately, people who are not much affected, pretty much most of us on the Zoom call, I would imagine, we are also cutting back on expenditure. And in fact, and this is again the stark asymmetry, not only are we cutting back on expenditure, but we're actually cutting back more than those who have been more impacted by this recession. And one reason for that is kind of the obvious one. People are running out of options to spend money on things because you can't travel, the luxury goods or so on. You can't spend as much on those high ticket item services. And so the expenditure by those who have been impacted less has been cut back the most, actually, ironically. Now, this is the unequal nature of the recession that I was referring to. This is very unusual, right? So that's the point I wanted to highlight. But now let's take a step back. And, I like to think of the macroeconomy, and this has some very deep implications for the macroeconomy. Obviously, when people who have the most income are not spending and are cutting back drastically, that basically means the savings at the top end are rising incredibly fast compared to sort of the trend line that we were on. And that creates this liquidity trap, if you will, that the economy finds itself in. So that's sort of one immediate issue that the economy is facing. But the other natural implication of that is that the way people are getting impacted is not just very unequal, but it's going to have very persistent unequal effects. Because the other dimension of this is that, we only, I just talked about the income and the expenditure side, but the third element of this recession is on the wealth side, which again, unfortunately, is also highly unequal. So if you think of the stock market is once again booming and so on, but the impact of that is again very unequal. The rise in wealth is in sort of these new tech sectors and so on, and those sectors are highly concentrated, first of all. So those gains are going into, again, are very skewed, are very unequal, number one. And number two, whatever those gains are, they are only accruing to those who already have assets to own. And so the present value of all of that recovery, if you like, is being again concentrated into a very skewed population, a very smaller fraction of the population. And many of these points have been very well. I see Gabe Zuckman is on the call, and this really remarkable work by Piketty Saiz and Gabe. I mean, it's very much related to the stuff that they have put together. But the additional point I want to again emphasize here is that it's not just a moral or a philosophical question that inequality is bad and inequality is very extreme. It is now impacting the macroeconomy that we are all getting pulled down because of this extreme accumulation of income and wealth and the resulting liquidity traps, or as we in our most recent work like to call it, the saving glut of the rich at the very top, that it is constraining the economy now. And the reason it is constraining the economy is that there is not sufficient demand as a result of that pullback in spending at the very top. And number two, the other deeper problem is that saving, we typically think savings equal investment, but that's actually a wrong notion. That saving is not going into real investment. So it's just going into quote unquote financialization of the economy, which essentially means that until and unless you can generate some more credit, the economy starts to collapse. And that's what has been tried in the past through first this boom in private credit through the household side, and now more recently through government credit, because obviously governments need to expand fiscally. And so that cycle has kind of running a natural end, and that natural end shows up in the very low interest rates that we see all around us. So let me try to bring back, there's a lot to talk about here, but I'm running out of time. Let me just bring it back to kind of the immediate, which is in front of us. What does all of this mean in terms of what needs to be done? So the one obvious point which a number of people have emphasized in sort of the public discussions of this is that we need fiscal support. There is no doubt about that. No one can deny that we need fiscal support. And in particular, we need fiscal support for state and local governments who are facing a budget balance. So they should not be cutting back on spending in this environment. And obviously for the unemployed and the core section of the population that is being impacted the hardest, they need to be provide the spending power that they need. But then the other two dimensions, which are more structural in nature, but I feel they should be part of the short-term stimulus as well. The first one is I talked about kind of the saving glut at the top, at the rich. That needs to be addressed through tax policy as well. And many progressive tax policies have been proposed, which I think they all go in the right direction, but going from estate taxes to wealth taxes to higher income taxes and sort of preventing stealing of taxes and so on. I think all of those are excellent suggestions, and I would hope that that the political leadership kind of takes that challenge on. And I would even go as far as we should also think of cutting taxes at the lower end for the bottom 90% in particular. That is a stimulus. So I think it's I don't want to think of tax policy as revenue raising. I mean, that's an important point, I think, from a macro perspective. I want to think of tax policy as stabilizing and balancing the macroeconomy, which is in the fundamental unbalance right now. So I'm thinking more of tax policy to balance the economy as opposed to necessarily as a revenue raising exercise. Because again, with very low interest rates and so on, that becomes, at least in the short run, less of an issue. But again, I think tax policy is equally important from a stabilization perspective, and I wanted to emphasize that. And it's in that sense that I, again, want to come back to what I started off by saying, that intellectually this separation or so-called separation between the short and the long run is really, we no longer have the luxury of doing that. The last thing I'll say on the immediate thing is, and this again usually is in the long run bucket, but I think when we talk about spending, it just cannot be just about transfers, whether it's unemployment insurance and so on. We really need to talk about spending from an investment perspective as well. The other overlooked, I mean, Amy just beautifully described kind of this public-private partnership on vaccines. It's a small example of what public investment can do. But the other big fact about public investment is that it's been falling drastically from the 70s onwards. And that cycle needs to reverse. So when we talk about fiscal expenditure, I think we also need to talk about the composition of fiscal expenditure. And the piece dealing with public investment has really declined to a level that I think is not sustainable for a country like the US to really stay at the level that it's reached historically. And so public investment needs to rise. And when we think of public investment, the one kind of sufficient statistic we need to think about is that the public investment needs to be in areas where the returns disproportionately go to the bottom 90%. I mean, I think that's the rule. And then obviously there's a big question of what that means. But I think as a rule, we need to think of public investments that disproportionately, the returns go to the bottom 90%. And again, I'll just end on that because the fundamental problem is we need to rebalance the macroeconomy. And so the growth process needs to become more equitable for us to get out of this persistent liquidity traps that we find ourselves for a long time now. And this is really a long-term problem. And to address the short-term issues, we need to get out of this long-term trap as well. So I'll stop there. Thank you so much.
Thanks a lot, Atif. That was great. Hillary, do you want to pick up there?
Yeah, thanks for having me. Very interesting conversation. Well, there are several things that Atif talked about that really tee up well what I want to focus on, which is primarily thinking about the current situation that we're in, particularly with respect to the more disadvantaged population in the United States, a little bit of a look back of the successes of earlier in the crisis and what we need to do next. So I want to try to do three things. One, very quickly catch up on the real-time data on how the most disadvantaged Americans are faring right now. Answer, really badly. Even prior to the sunset of some of the key CARES Act elements. Number two, just a little bit of a roundup of what we did back in March and a little bit of a good news, bad news story there that helps us, I think, not only assess the problem, but think about how we need to do better in the next round. And then number three, some thoughts on what we should be doing now. And if we have time in the discussion, maybe a little bit beyond the current relief situation, some of the issues, and my thinking lines up in many ways with many of the things that Atif just discussed. So number one, real-time data. This issue about the unequal aspect of the shock is a really important setting for starting to think about who is really hurting in the United States. So just to add on to what Atif said, just to give one statistic on that. So recessions are always unequal, but this recession is quite different in terms of the magnitude of the unequalness and some interesting issues around gender, which is very different that I'm not going to talk about. But just one fact, we see that the initial shock was much greater for lower wage workers who were in sort of person-facing service industries. And what we know now by mid-September is that employment for the lowest wage quartile workers is still down by about 20%. This is from the most recent data coming out of Opportunity Insights in the last couple of weeks. Whereas in the highest wage quartile, there's no reduction in employment. So we see this very persistent, very magnified loss in employment by the lowest earning Americans. Number two, through this Census Pulse survey that's been fielded throughout the crisis, we see regular real-time data measuring quite dramatic levels of food insecurity in the United States, unlike we've ever seen before. So a couple of statistics on that. We've seen a near tripling of the share of families with children who report to be food insecure, which is essentially answering a question such as, over the past 30 days, was it sometimes or often the case that food just didn't last and they didn't have enough money to get more? Just in the last data point from the Census Pulse survey, those numbers are particularly elevated for families with children. We think, poverty rates in general are higher among families with children, but the closure of schools and the loss of school meals that 30 million children get in America through lunch and increasingly breakfast programs most likely added to the severity of that sort of nutrition shock. In the latest Census Pulse data among families with children, Another dimension of disparity, we've got 23% of Black families with children reporting food insecurity, 19% in Latino families with children, and 10% among white families with children. These rates have also more than doubled for families overall, not just families with children. We also see incredibly unprecedented use of food banks. We've all seen the long lines of people lining up to receive food from food banks. That's also backed up in the Census Pulse data. And I already mentioned the loss of school meals, particularly abruptly when schools closed back in March. So that's the sort of real-time assessment. And we see that these measures of deprivation were very elevated even before the CARES Act key measures expired, and they're continuing to creep up post the middle of the summer. So the good news about the relief efforts, I think, comes down to the fact that there were, these 4 elements that we know were very important for providing a lot of protection. The expansions to unemployment insurance through the $600 per week top up, and importantly, the expansion to self-employed workers and those who were previously uncovered. We had the pandemic relief payments of the $1,200 per adult, $500 per child. Really important expansions to the food stamp program that got because it's sort of ready to go, showed up in terms of very quickly translating to increases in dollars in people's pocket. And we also created a new program called the Pandemic EBT program, which was a way to try to compensate families for their lost school meals through the form of a debit card that they could use for ordinary shopping, essentially replacing the costs that schools were now not incurring by providing school meals. So these kind of 4 direct payments to households ended up at about $600 billion in new spending through the end of July. So that's sort of the good news. The bad news is that we see these very high levels of economic need and deprivation despite this spending. And some work that Marion Bittler and Diane Schanzenbach and I did for a forthcoming Brookings paper sort of does a bit of a forensic dive into why that is. What is it that was missing? And we came up with 4 reasons. Number 1 is timing, probably the most important reason. Kind of getting back to what Atif said, these states are overwhelmed. We know it took months for even programs that were already in existence to get out, let alone getting out the new programs like the stimulus payments to those who hadn't filed taxes, and the new programs such as the PUA for unemployment and the PEBT for school meals. Number 2, the coverage is incomplete. We see these reoccurring themes of inequity and take-up of unemployment insurance, which we thought wouldn't happen with the $600 top-up, yet the same inequities across skill group and wage levels and race are showing up now as they have in prior recessions, with lower rates of conversion of eligible workers to getting unemployment insurance. Number 3, the policies were not inclusive. They explicitly left certain groups behind statutorily, including undocumented workers not being eligible for unemployment, the stimulus, the relief payments not being extended to families where any adult in the family was an ITIN filer. And then finally, the magnitude of the benefits outside of unemployment were not that high. So that's sort of the bad news. So going forward, what do I think we need to do right now? I think there are 3 elements that sort of define what we need to do. We need to do things that are fast and targeted, and we can't forget the states. So Atif already mentioned the importance of getting money to states. So let me mention a few things that I think fit in with the fast and targeted. So we definitely need to extend the unemployment insurance eligibility, which right now is estimated to more than 15 million people will lose their unemployment by the end of 2020. We need to focus on these targeted elements where we know that the need is greatest. SNAP is doing a great job. We need to do more. The pandemic EBT program took forever to get out, but goodness, let's keep it going for these kids, particularly those that are not in school. In terms of the relief payments, the cost of the $1,200, $500 payment back in March was more than a third of the total direct payments to households through the end of July, and was extremely untargeted. So if we're going to go for another stimulus payment, which a relief payment, which I think would be very valuable to a large subset of the population, we need to make it more targeted, because otherwise I think the money could be much better spent in other categories, in other areas. And then finally, as we start to think beyond the crisis that we're in now, I think we need to think about a couple of things that are kind of wonky, but could be very important for protecting us to do better the next time around. And so perhaps we can talk in the discussion about more broader elements of the social safety net following Trevon's comments. But let me just make a couple of statements that I think could prepare us better for the next crisis and are also just good policy. So thing one is infrastructure spending for states. So could we build into an infrastructure bill something that helps us do better in administering the programs that we have at the state level? That's one thing to think about. A second thing to think about is if we had better linked administrative data in the United States, we could have done a much better job of getting out payments faster and more equitably and in a more targeted fashion than we did. And so building up administrative data systems are not only good policy for research and everything else, but also for the efficacy of getting payments out in a particularly important time such as we have right now. So thanks very much.
Thanks. I was just writing that all down curiously. Thanks a lot for that, Hilary. That was great. Trevon.
Great. Thank you for this invitation to speak about this. So this is going to combine a bit of everything that's been talked about so far. And so I'll start with just the racial implications of this pandemic that have really, really cut and shown to be highly disparate. When we're thinking about heterogeneity, this pandemic sort of highlights heterogeneity in all these dimensions, which I think reparations could help to solve. So as of today, 1 in 875 Black people in the United States has died of the coronavirus. Right? That rate is higher than it is for any other racial group in the United States. And the unemployment rate for African Americans as of the last jobless numbers that were coming out was still above 10%. And they were the only racial group who had unemployment above 10%. So in all of these dimensions, we have to start thinking about how they cleave along racial lines. When Hilary was mentioning the fact that employment was down 20% among the lowest wage workers, those workers are disproportionately Black workers. And it's one of the reasons why the unemployment rate is still so high. This sets aside the fact that we now have departures from the labor force that are also racially disproportionate and also gender disproportionate of people who have, for a variety of reasons related to the pandemic, simply left employment overall. Highlighting this with what Hilary was mentioning about food insecurity with these families, the 23% number for African-American households with children is actually down a bit. It was over a third of Black households with young children had food insecurity problems late in the summer. So it has actually improved in the last several weeks. And what's going on underneath all of this is another disparity in terms of the ability of African Americans to work and manage this crisis. Fewer than 1 in 5 Black workers can work from home in their occupation, which stands as a difference. I believe it's more than 35% of whites. If we're thinking about how this works along dimensions of income and income support, fewer than 40% of African Americans, according to the survey of consumer finances, could expect to receive $3,000 from friends or family members in a crisis. That same number was over 50% for Hispanics, at 57% for Hispanics, and it was at 71% for whites. If you consider what the sudden drop in employment and drop in income has been for households, these African-American households are the least cushioned to handle this sort of crisis and budget crisis in their household, and they're the most likely to experience it. But underneath all of this are just two numbers I want to put into your head, and then I'm going to give you some further statistics, and then I'm going to talk about how reparations helps to solve some of the problems related to the macroeconomic issues, but also related to the social safety net issues. The first number is $188,200. That is the median wealth of a white household, according to the Survey of Consumer Finances in the United States. The next number is $24,100, which is the median wealth of a Black household in the United States. Once again, 188,000 and 24,000. That is the size of our racial wealth gap at the median. The breakdowns, however, are even more shocking. For those with a bachelor's degree, okay, those who have an undergraduate degree, the median wealth for whites is $278,200, according to the Survey of Consumer Finances. For African Americans, it is $49,700. So cutting this by education shows a stark disparity. But it's more dramatic than that. For those with no high school education, median Black wealth is $7,010. Median white wealth is $71,800. So a white person without a high school education has higher levels of wealth at the median, a substantial amount, $20,000, more than $20,000 more in net worth than an African American with a college education. This is related to long-standing factors that go along two dimensions, which reparations can help to address. The first are large wealth transfers that were directed towards white Americans historically, and which are now essentially part of our structural nature in the economy. These are Homestead Acts. These are federally subsidized mortgages. This is infrastructure investment in white communities, allowing for whites to, for example, form suburban communities, subsidizing mortgages where there are restrictive covenants and the like, which allowed white households to build wealth irrespective of their own human capital position. That's the first element. The second element is the active exclusion of African Americans from those wealth transfers. And this leads us to the situation that we have today, which is a substantial wealth disparity, which in and of itself gives rise to other forms of disparity. If you cut, for example, rates of hypertension by income-related stress, they're exacerbated among African Americans. Why? Because they are at the bottom end of the economy and they experience these shocks, which cause high levels of stress, which can lead to these health implications. If you look at the work, say, of James Jackson in thinking about behavioral responses to stress, you would see that this would give us patterns, for example, of higher rates of diabetes and hypertension due to behaviors, particularly food consumption behaviors. And this is leaving aside the issue of food deserts, which would give rise to higher rates of diabetes and hypertension, which is another aspect that cleaves out these racial disproportionalities in mortality from the pandemic. So it is very important that we address racial wealth disparities before the next recession. The wealth numbers that I just gave you, that 24,000 and 188,000, that comes after 3 years where Black wealth grew faster than white wealth. This is not going to be solved by attempts to slowly grow or even outpace the growth of white wealth to solve this problem. And these wealth differences are baked down and intergenerationally transmitted. when we take on top of that the Opportunity Insights findings about rates of intergenerational mobility, which are perceptibly low in the African American community, this problem just gets worse over time. So what we have to think about is a policy that would directly address the source of this racial disparity in wealth, which would be a reparations program. Now, I have thought about this independently, and so I want to be very careful to say that these are just Trevon's back of the envelope calculations of how to have a very large wealth transfer. And we certainly can't do something like a contemporary Homestead Act. That is something that some people have discussed, but I do think there are some mechanisms that we can use. The first would be a direct cash transfer. There are some aspects of thinking about doing this in terms of using treasury notes and other ways of having a direct transfer. I don't believe that the size of a transfer has to be particularly large, but I also believe that a direct transfer of wealth, simply of income, frankly, would be symbolic in nature. And I think it would be absolutely important. The next vehicle, though, is directly related to sources of wealth that are racially disproportionate. And one would be access to real estate and, in fact, home ownership and real asset ownership. So the next vehicle to address this would be what I've considered to be these sort of housing or real estate bonds. So every eligible reparations participant can receive a bond, essentially, that is worth, say, something around the order of $50,000. They can use that themselves in a real estate transaction, or they can transfer it to another eligible participant to use in a real estate transaction. So this is how actually wealth transfers work today for families who have substantial amounts of wealth, right? Parents are able to use the equity in their own real estate holdings to subsidize their children's acquisition of additional real estate. And this would work in that mechanism. This could also be used to purchase commercial real estate if business owners wanted to either combine with each other, and they could take their $50,000 and combine it with another business owner's $50,000 and purchase commercial real estate properties. And this would also allow, for example, the establishment and greater rates of home ownership. We would have to worry about the ways that this would affect housing prices in particular areas, but that's another side effect of that. But that would be one direct transfer that could happen actually pretty immediately. I'm going to leave aside the legislative process of making this happen, but it would be something that would actually directly have an impact on wealth. The second is actually the establishment of greater involvement in asset markets. So the same way that you could have a bond that would invest in real estate transactions, every eligible participant for a reparations program could be granted $50,000 in assets that could be used in an account. This would essentially be a glorified, say, Vanguard account that would initially be invested in a market index fund, right? Something with very, very relatively low risk, but still having someone exposed to the asset market overall. And you could have these actually designed that over time, they could move those funds to other funds, but they could also transfer within those funds other assets to that account. If that account, for example, was to be tax-free, and only tax-free as long as the original recipient were the one, or their designee were the one to draw from it, that would actually tax advantage those accounts, which would allow them to accumulate wealth a bit faster than others that would be similarly taxed. So you can think of this as sort of a really high speed or high fueled sort of Roth investment account that would increase the wealth holdings of reparations participants quite similarly and very, very quickly. They could also be allowed, for example, to take out loans against that holding for the purposes of sort of to solve liquidity problems in the short term that would have to be paid back from that account. So that would be another way of inducing that sort of a transfer, while at the same time protecting wealth. So what would those actually do if you had those sorts of things in place? The first thing that it could do, if you think about sort of a large transfer to those who are reparations eligible, thinking about the statistics that Hillary was giving us, it would immediately, I think, help to solve some problems that we have with food insecurity, right? Immediately begin to solve some problems that people would have, for example, in being able to pay their rent payments, for example, in this very, very short run, if you had a cash transfer system like that. These are very, very important issues that must be solved immediately. But getting back to Atif's point, it actually would help us solve some of these macroeconomic issues where we now know in these new classes of heterogeneous agent models really are the source of a lot of our macroeconomic perturbations, right? So we see this in the way that the wages have recovered at the highest end of the income distribution, that the people who are driving sort of the fluctuations in a lot of these shocks are at the lower end of the income distribution and the lower end of the wealth distribution. And lifting those people up would actually, I think, be a macroeconomic stabilizing enterprise if we could enter into it. And so that is really where I think reparations become something that we don't think about and don't put into the box of long-term policy, but rather thinking about something that we could move on in the short run, which would help us macroeconomically for the next recession.
Thank you. Thanks, Trevon. That was great. Okay, so I think I just wanted to have one question and then open it up to the floor or the chat. And sort of the question I have in mind for all of you is like, what are the political paths to implementing to getting this stuff kind of done? And so for example, with Atif's sort of agenda, it's like you can imagine some of it's going through the Fed, some of it's going through Treasury. You know, in Amy's case, I'd be curious about what are the bureaucratic or what are the levers that the administration actually has to implement the things that you have in mind. So if you want to just take like a minute or two and just kind of get into brass tacks to the extent that you can, and just say like, oh, here's a couple of ideas of what administratively and politically you could do to realize these, that would be great. So let's go. Let's maybe start backwards, Trevon. Yeah, that's the hardest one for you, I think. It's the hard.
Could you
imagine the Fed, right? Yeah, okay. Okay, so you want me to I'll start with Atif first and let you think about it. Okay, Atif, go ahead.
Yeah, no, this is a hard question. One thing I'll say just in general on these kind of questions is, I mean, I think there is something to be said about sort of separation of roles in terms of what a politician is supposed to do and what an economist is supposed to do. I think just as a starting point, I think it's important that we sort of give the framework in terms of, you know, here are the things that really need to be done. And I just want to say that, you know, while political feasibility is very important, and I think it's exactly the right question, I just want to give a shout out that economists should be highlighting what the problems are, regardless of whether the solution is politically feasible right now or not. I think that's one of the jobs that we are supposed to do in terms of communicating ideas to the public. And so I think we need to be bold and we need to be courageous in suggesting proposals that might appear in the short run to be not quote unquote feasible. So I just want to give a shout out to sort of those kind of proposals. So I think part of what I was trying to say was exactly that we need to be bolder and we need to be willing to say things that might not be seen as conducive in the current political environment. And I think the stuff that Trevon, for example, is talking about is exactly along those lines as well. And I would really encourage those conversations. A lot of the things don't happen because we don't talk about them. I think, and we underappreciate the power of conversation, and we underappreciate the power of sort of, you know, sparking new ideas in the public sphere. So I think one important thing is exactly to do what you guys and Danny and others you are trying to do here, is to plug in new ideas into the public sphere. So I think there is a role for that. That's number one. Number two, more on the practicality of things. There's a lot of room or maneuvering always available to at least start moving in the right direction. And that's where I was talking about things like, adding public investment, a serious public investment initiative within the sort of the expenditure priorities that the government proposes. I mean, if that's certainly a choice. I mean, how much you spend in sort of, unnecessary wars, for example, versus, public investment that the country needs for drinking water and things of that sort. I mean, those are very much the choices, and we just don't have a proper conversation about those kind of important issues. But there is, there is also, I think, bolder conversation that needs to happen from the progressive side. So, for example, I talked about tax policy. I don't understand why the sort of the progressive side lost the sort of the economic mantle. Like it's really surprising that when you poll people, they always tend to think of the sort of the conservative positions as more economic friendly. I mean, even though the data sort of screams that that's not true, but the public perception is, so that's where I would fault the politicians and the communication, that we've completely failed in communicating to the public. And I think tax policy perhaps is one example of that. So I would actually go for actually on the platform of lowering taxes for the bottom 90% and making it revenue neutral, and whatever you lose on the revenue side, you say that's what you give to at the very top. We know that would be incredibly politically popular on the ground. But the reason that stuff doesn't get traction, I think maybe we want to think about, what are the incentives of the politicians and so on. So maybe that's where we need to have a more serious conversation. So I'll just end on that. I mean, I think our job is, again, to push for bold ideas. I think we as economists, especially those with tenures, we need to be bolder in terms of what we project out there in the public. And then it's the politicians' job to take it to the people. And they are not doing exactly the best job on that right now.
Got it. Thanks. Yeah, I'll just defend the question and before I go to Hillary, in the sense that I think too often think of our role as, well, my job is just to make the prescription and not to have ideas for the real political economy constraints and really try to think of how could you design this policy in a way that would satisfy a given set of real world constraints. We're like, oh, that's not my job. And so, but in some ways, the policy design problem has those features in it. So that's why I asked the question. So Hillary.
Thank you. Let's see, I'll take license with this answer to talk a little bit about beyond the relief period, because I think, the political dynamic about what could be passed in this current period. I mean, we just got a new bipartisan something that might be brewing in the Senate. But let me talk a little bit further beyond the relief, beyond the real short run. And I guess I would stress two things that I would put high on my list of things that we should be doing to shore up the social safety net going forward. And the first comes out of the observation that, like Atif was talking about the declining public investment over time. Another layer of that in the context of my world and the social safety net that's very relevant is we have a social safety net that has really transformed in the last 25 years to be one that is all based on conditionality. So any kinds of resources that are extended to the low-income population are very much targeted at those who are working. So this building up of conditionality in our social safety net is an incredibly strong feature of the evolution over time. And it's basically one where, we've got a low wage economy, so let's use the social safety net to, at best, top up low wages. And obviously one can see that that is not a very well-designed social safety net for the kind of social insurance part in terms of times like we're having today with respect to insuring against earnings declines and other things that aren't perfectly insured by the unemployment insurance system. So I think we should be thinking seriously about that pendulum swinging back to not have a world in which we have so much conditionality. And I think the logical first place to start on that, and this is where I'm like living in your world of what I think might be politically feasible, but honestly, who am I to say, is, one thing that we have that was expanded in the 2018 Republican Tax Act is a child tax credit that is worth $2,000 per year per child. And it is phased out at a very high level of income. If you're a married couple, you still get the child tax credit at $200,000 a year in annual income and higher. The child tax credit is not fully refundable and is not even sort of refundable on first dollar earnings. So there's this remarkable fact that there are more poor children who don't get the child tax credit than there are the wealthiest children who don't get it because their income is too high. And so it's a very kind of logical extension of a given system that might be built into reauthorization of the tax rules, but that probably is going to happen too far in the future, where you essentially take this $2,000 and extend it all the way to zero income. And while this would be modest and is smaller than, say, the child allowance in Canada, which is about $6,000 per child per year, Canadian dollars, I think it would be a structure that we could build on. And I think that there's a kind of fairness argument that one could bring in about an existing structure that is providing benefits per child to some groups and not others that strikes me as a place where there might be something we could do there. The second thing is, Lord, this seems like the time to do something to try to modernize the unemployment insurance system, even aside from what I was talking about before, which is more infrastructure and administering the program at the state level. Does it make sense that we have a system that has such varying benefits across states? States are cutting back on weeks, they're cutting back on benefits. We've got incredibly low replacement rates that required us to do the $600 top up in the first place. I don't know. That seems like something we might be able to get some traction on given the visibility in the current crisis. So I guess those are just two things that I would think about. And I guess I would just come back to this kind of wonky thing about if we build a better administrative data system, a lot of these things that we want to do, we could do so much better. Like suppose that we had a world in which, and this is something a state could set up a system to do, when a worker loses their job, what if they're contacted and say, hey, I see, Trevon, you lost your job. You might be eligible for food stamps and this and that. I'm going to opt you into these things. Let me know if you don't want them. Like that is something we could do and would really make the system work a lot better. And I think we should be thinking about combining, the state building of administrative data systems with other kinds of technology to just do better at delivering what we have.
Got it. Thanks. Okay, Trevon.
Thanks for this. I think so. One thing I'll push back against Suresh, because that this is what I do, is that when the idea that as economists we should we're not designing policy is actually, I think, a bit a historical, right? So there has been a move of economists, certainly in the 1950s and 60s, in the push for a more conservative role for economic policy, who were actively designing policy and had large influence. And so I think that the what I call the sort of faux scientific ideas that we should have as economists, as social scientists, in terms of policy design, I just don't think matches with the actual history of economists being involved in policy discussions. And so I think we should take it as our call to be active in policy discussions. In terms of feasibility, I really do want to agree with Atif that, you know, it is the time to be bold. We can at least begin putting these ideas on the table. I will have to say, you know, over the course of my own career, if you'd have told me in 2008 that reparations would be a legitimate issue in the Democratic primary for a presidential election, I would have just laughed in your face. That would have just been the farthest thing from anybody's mind. And it literally is an issue that was debated on the stage. That in and of itself is actually progress. And I don't think that we should take that lightly about things that are now considered and at least discussed, although they might not be necessarily feasible. The same thing with, say, student debt cancellation or forgiveness. If you would have mentioned that in 2008, I don't think it would have had any traction. And now it's a really serious issue. So I think that bringing these issues up and pressing them continuously is certainly something that we have to do. And I think that designing these policies, and I don't think that what we want to do is lose our first mover advantage, right? So coming up with ideas that then have to be responded to, I think probably is to our advantage to be actually bold, right? So we come up with something that's particularly bold, maybe it is overly aggressive, but it's the first and only sort of action and policy that's in play or being discussed. And so I think that actually encourages the other side maybe to either come up with a policy or reveal that they don't have one. And I think that would be one way of at least considering these as policy options.
Okay, Amy.
So I'll start with the foreign policy piece. I mean, so that's entirely within Biden's domain. If he wants to, you know, sort of allow other countries to go ahead and use their rights under the WTO's agreements to manufacture and sell bioequivalent or generic vaccines, he can do that. Pretty straightforward. On the domestic side, you know, there is, you know, likely going to be a new stimulus bill, and there will be surely some amount of money in it for vaccine distribution. I think the big questions there are going to be like what Hillary describes of how much, you know, well, are they going to be to scale? And then how do you think about the longer term issues that these in a way are just a representation of, right? So, you know, Congress has already done quite a lot more to make sure that price is not an issue, that it creates barriers to COVID vaccines than it's done for anything else, right? And yet that raises the obvious question, you know, why just COVID vaccines, and what about the long run if we need COVID vaccines to be, you know, done multiple times? You know, there are, you know, we have no systems in place to address drug pricing or availability in a serious way more broadly, and we have huge issues in that regard in this country. You know, obviously health insurance, you know, we knew in 2019 we had 29 million Americans uninsured. You know, nobody knows exactly how many are uninsured now, have lost their insurance. EPI estimated 12 million recently just because of COVID. So what to do about that longer term problem? Fixing our health insurance system with something like Medicare for All or some other kind of universal health insurance system, you know, that's a really critical problem that I think does require a level of political will. So, you know, that we don't yet have. I guess the last thing that I will say is I think that there are a number of ways that that we can try to think about what's needed in the short run that can help us in the long run. And that's what I think is useful. Not that everybody needs to be thinking about optimizing, you know, policy solutions for our political economy, but many of us, I think, who are interested in building and in more ambitious structural change, I think should be responsible for thinking about how do you build policies that are going to build power over time. Some people talk about this as democracy entrenching, other people talk about it as power building or non-reformist reforms. I think one reason that I've been excited about the idea of a jobs program is to take the moment of COVID when there is political will and space to do something, even at certain moments bipartisan will, and try to leverage that into something that could help us get to sort of a bigger scale jobs program that was federally funded but locally implemented, for example, that would help us understand some of the potential and issues with broader jobs programs, given that that is likely to be something important on the progressive agenda for some time to come, and that would help us build out a public health infrastructure and a care workforce infrastructure that is frankly deeply important to people of color and to women because of who disproportionately is in the service economy and in the caring economy, right? So to try to use, I think we should all be thinking about how we can take proposals that do have some possibility of success in the current moment, and think about the ways that they might be designed to build infrastructures that help us in the long run and that help give authority and power to people who have not been allowed to be full participants and full citizens in our democracy, so that at the next time around, we have both visible policy successes for those folks and people more engaged with politics over the long run, which is what we need to get to some of these longer term issues, from reparations to Medicare for all kinds of things.
Great. Thanks a lot. I'll just open it up. And so I think people can either type a question into the chat box or unmute yourself and ask.
Can I ask Amy a question? Danny here. Amy, you mentioned the complicated issues with regard to the intellectual property rights of the new vaccines. And this is an issue that I find very hazy and confusing. And I just don't understand fundamentally why there isn't more transparency when NIH and other public funding bodies are so intimately involved in funding, in this case, vaccines, but more broadly, pharmaceuticals innovation in a number of different areas. Why some of the relevant contractual arrangements are not, I just did an internet search. You can find some of the contracts, but they seem to have been obtained. It's not clear they're actually on government website. It's not actually clear they resolve the uncertainty. So can you say a little bit more about why is it that we actually don't know more about what exactly is being agreed to in these collaborative funding arrangements? Why we don't know exactly what can happen after that? And based on past practice, what is it that we could actually, if the world were to continue like it was, before, what would we actually expect in terms of, whether the public would be able to claw back some of the rents and so forth?
Yes, it's a great question. There have been a lot of attempts to use the Freedom of Information Act to get access to those contracts. So you've got this $10 billion. And almost no visibility at all in the U.S. To the contracts and the terms of the contracts. You get back from the agency's fully redacted documents, basically. And there have been some lawsuits now. People are trying to get to make the Freedom of Information machinery work better, but it's not a very functional machinery at this point. The sort of Freedom of Information systems we have in the U.S. It's an issue in Europe too, actually. CEPI, one of the initiatives that's been involved in the COVAX vaccine, they have funded also some of these vaccine candidates, and we don't have much transparency either into the conditions of those. Unfortunately, the little bit that we do know from some of these efforts is that there are some statutory safeguards in the United States, for example, like the Bayh-Dole Act, which does create a government march-in right where the government has funded research. And it seems like BARDA, which created the contracts, actually wrote out that requirement into these contracts, at least for some of the companies involved. So actually did the opposite of what you would imagine they might do, which is use the massive amount of leverage that they had in this funding to actually go further with respect to access in these agreements. So we don't have visibility into that. I think the bigger problem, and this is something that I'm quite interested in and have been working on, is the arguments about kind of corporate secrecy that pervade these areas of government procurement and government contracting. So companies try to argue that these are trade secrets or at least sufficiently confidential that the government can't release this information. And we've seen that all over COVID. We've seen it with respect to when there were drug shortages. We've seen it with respect to what the Treasury loans who the Treasury loans have gone to is that companies just claim that these are all confidential and can't be released to the public. And we don't have very much, obviously, legal ability to kind of get behind that, given the kind of current difficulties getting FOIA to work fast or to work enough. So I could say more about that if you like, but I think in terms of your second question, what is the likelihood of kind of clawing back some of the government rents? The existing examples would tell us very little, almost no likelihood. I mean, the US has never really exerted its authority to get back good returns for the public when it invests money in research. It has treated that all under something like a public goods framework, right? That it just hands off all of those public goods to industry and allows industry to then set the prices and layer monopoly rights on top of those public grants. And so, this is something that there's been a lot of attention to in recent years to try to change the status quo and to articulate some principles by which the public would be entitled to lower prices or some kind of opening up of monopoly control in exchange for all of that funding. I guess part of what's happening is there's a dance where the companies have actually priced these vaccines not at some of the exorbitant levels you've seen some of the other recent price tags for new medicines. And I think they appreciate that there's so much political focus on this that they are vulnerable to those kinds of actions. So under existing law, for example, which I've written a lot about, the US government has the right to simply purchase generics without regard to patents and pay compensation under a kind of liability rule, something like a compulsory license, if it chooses to. We have not done that since the 1970s. And that is because basically of the lobbying power of the pharma industry. So there are actually powers. You wouldn't have to pass a new law necessarily to get through Congress to actually truly put a little bit more pressure on companies should they refuse reasonable terms, or if you want to open up supply. But we don't have any real recent experience of them being used. That said, there is a lot of attention to this. My own view is also that those kinds of approaches, again, this could be an area where we could possibly use the COVID vaccine or new treatments, which are also going to be an issue, to try to set precedents that would help us in other areas. So we also don't get just a kind of exceptionalism around COVID and be left with the same old structural problems that we've had for such a long time.
Great. There's a broad question in the chat. What does the panel think about educational opportunity as economic policy? I'm going to target that one to Hillary. But other, Hillary, go first, and then anyone else that wants to chime in, go ahead.
Sure. I think one way that I would think about, to even take that question and broaden it out a little bit even farther, and this kind of gets back to this lack of investment and what our priorities are in our budget. What is the term? Like budgets are priorities, or whatever the expression is. Like our budgets do reflect what our priorities are as a country. And I think we're learning, there's this very exciting research agenda that's growing so quickly right now that is really putting really good, quantification of, the benefits to investments such as educational opportunities and other things that we don't always think about as investments, like providing adequate income to low-income families when their children are young. And, our research for a long time was sort of focused on thinking about these things in more of a short-term sort of framework. But as we get the data and the designs in order to evaluate the longer term, we see that a lot of investments in education, as well as kind of ordinary social safety net kinds of spending, really does kind of almost pay for itself in the longer term in terms of setting people on a different trajectory, increasing their earnings in the long run. And so, I think that we should be thinking a lot more about taking what we know about what programs kind of yield, what kinds of spending as a society yields rates of return, and to start thinking in this longer term lens. And I think that would put educational opportunity as an important aspect of economic policy, for sure.
Anyone else?
Maybe this is not related to what they were talking about, but I was wondering if you guys have anything to say about childcare and maternity and paternity leave policies that could maybe fall into the short run policy priorities, or maybe not, or maybe it's a more long run thing, but given COVID, it seems...
Yeah, let me broaden that out and also just think about like the gender inequality dimensions, both under COVID, but also, you know, going partly because this plays a big part, I think, in the gender inequality that's been magnified by COVID. So yeah, that's a good question. It is both a short run and a long run question. Any takers?
I'll throw a few things out there to start. I mean, it's startling if you look now at the data for men and women who are not in the labor force or not working. What are the main reasons why? And you see this real shift, like all of the women who are not in the labor force right now are in caring situations, whereas the men are, you know, basically they don't have their job anymore. And so we see this gendered perspective that, you know, that has never really shown up in a recession before. We had some aspects in the March federal policies that provided some shorter term family leave, which are going to expire. And I don't know, I feel somewhat encouraged by having someone like Heather Boucher on the Council of Economic Advisors, who has been really putting front and center in a lot of her policy thinking and advancing around issues of family leave and more, and the sort of the care economy as the next big push for social policy in the United States. So I don't know what the chances are of that being successful, but it does strike me as something that could have more broader support than other policies.
Suresh, if I'll just say, I don't have, other people are better experts on this, but I think there's a broader theme here, whether what Trevon was talking about or this gender question. Now, the broader issue is that we all understand that there is a need to do something that raises mobility, that brings people up who are currently down. And I think it's a really important, that's the really broader question. And there are so many things one can think about doing. I mean, Trevon gave some examples. And I would really hope that there is some of this is institutionalized in the government sort of bureaucracy, that we learn through the examples of what is tried and what works and what doesn't work. I mean, I think at some level I want to see, I think while we all want these things to happen, I think at the same time, there's a bit of humility that we don't really know what will really work best. I mean, just to take Trevon's example, I think this question of wealth transfer or asset transfers and so on, I think we all feel that something like that needs to be done. But exactly what is the best mechanism to get that done so that it results in boost in productivity of these individuals? I mean, I think that's a very, and I'll be honest, I don't know the answer to that question. I strongly feel with Trevon that something needs to be done, but I really feel I don't know how it should be done, because I can imagine, we all have this example of Russia in front of us, which is, that all of these assets were privatized apparently and given to the people apparently, but then these oligarchs came in and they bought all of that at very cheap prices, and it ended up doing nothing actually. It ended up getting much worse. So I just feel that we need to be very careful about how we do this, number one. And number two, we don't have a lot of confidence about what is the best way to do this. So I think there is a serious kind of, you need some institutional kind of support behind these long-term initiatives, and we need to do this seriously.
Atif, if I could just chime in, that's such a terrific point, because say you do something like a property transfer bond that I was talking about, it could simply bid up the prices of existing real estate, which would of course enrich the current owners who are disproportionately white. And the same thing if you create these asset accounts, the existing owners are the ones who would benefit with this. So you have to create vehicles in addition to the transfers that actually make these transfers wealth transfers. And of course, if you do a direct transfer, particularly the size of what people would talk about reparations, you really have to worry about inflationary effects, right? So these really do come right into the wheelhouse of how do we institute these transfers. And it's amazing, considering these issues, the number of wealth transfers the United States has done historically that really weren't done without any, thinking about these sorts of issues. But certainly with the case today, you'd have to take these into account. And so I think design is critically important.
Okay, I think that is all the time that we have. Thank you, our panelists. This was really great, and thank you all for attending. And just to remind you, there's another one of these this afternoon at 4 p.m. on structural change and long-term policy priorities. So we'll see at least some of you then.
It's 4:30, by the way.
4:30. Thank you all. Thank you. 4:30.
Thanks, Suresh, for hosting. Thank you.